Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
Welcome back to The Point. This is Scott Long, Executive Advisor with Apex Benefits. And again, I am joined by a couple colleagues here, Roger Greenawalt, our Health Informatics Actuary, and Stan Jackson, our Chief Innovation Officer. Welcome back to The Point, guys.
Thanks, Scott. Appreciate it.
Absolutely. You know, on our last episode, we got together and talked about the short-term and long-term effects to claims cost and, you know, how preventive care might be affected and change from a delivery of care standpoint. On today's episode, I really wanted to get your guys' thoughts on what we're hearing the potential for, and that is a potential second and third wave of COVID. So, you know, Stan, to dive in, you know, as I said, we've heard that there is a potential for a second and a third wave of COVID. What are you hearing from the provider community in terms of their preparedness, their preparedness for a potential second and third or third wave?
Yeah, Scott, I think that potential does exist. There's certainly the warnings out there that this might occur and it may happen. I believe what will be different this time from talking to the provider community is that they will have the necessary equipment and supplies, you know, to safeguard their own employees and those individuals treating patients one-to-one during that time. So hopefully we'll get a reprieve from all that's happened. We'll get a chance to rebuild our supplies of as they call them, the PPE, the personal protection equipment, and be more prepared this time to meet whatever challenge comes. I think as well, we're learning more and more every day about how to combat this virus. Certainly there's no vaccine at the moment. We are trying different medications that some people have reported it has worked very well for them, whereas other people, there has not been a positive result for the individual to be, you know, to recover. So we'll continue to kind of monitor that. But I think, you know, what the message from the provider community is going to be is the minute you feel like you have the symptoms or you sense that you may have, it's going to be self-quarantine, stay home, you know, drink plenty of fluids, keep an eye on yourself for a few days, but then home testing and the ability to access a provider either telephonically or through a video chat is probably going to become more prevalent. Again, to contain the virus, to keep it in its one location where that individual has already resided while the disease is incubated. There are some home testing kits that have been developed by LabCorp, and I'm sure there will be others that will hit the market eventually. And we'll be able to treat people really from their own home, where there would be a mail-in type of kit, and the test results then would be expedited to the lab, and then the results turned around very quickly to rule either positively or negatively that the individual does have the COVID-19 virus.
Yeah, that's interesting. That's interesting. We're all going to keep our eyes on that for sure. Roger, how about you? How about maybe give our listeners, you know, an idea of what we might expect from an actuarial forecasting perspective?
Well, yeah. Normally, when we're making our projections, we're looking through the rearview mirror, and so we're looking at past experience in order to project the future experience. However, what the pandemic has created is a number of abnormalities that are going to vary by client by client that we need to adjust for. As we talked about in our last episode, what we saw during the shutdown process is significantly lower claims, and then that comes back after the shutdown is relieved, and all those past things that needed to be done are taken care of because they were simply postponed. They were not canceled. And so, and as we look at, so that changes how we take a look at our world and our projection on a going forward basis. Now, in addition, I've had conversations with other actuaries and underwriters from marine insurers to kind of get their take on the overall impact of both the current wave as well as what the second wave, so that we can appropriately adjust our models. Now, if we just take a look at the costs associated with the pandemic, we've got the cost of testing, we have the cost of treatment. Right now, there is no treatment. A variety of avenues are being investigated with costs that can range anywhere from $25 to $50 up to $2,000. Obviously, if the only effective treatment is going to be $1,000 or $2,000, it's going to have a lot larger ramification than if it's $50. We also have the cost of the eventual vaccine. We don't know how much that's going to cost. You hear numbers bannered about. The one that I'm going to pick for my example is $200. It could end up more, it could be less. But for example, if the cost was $200, that is still a cost that would need to be incurred for every member of the group that the employer has. And so if they've got 200 employees, let's say they've got 500 members, that's still $100,000 that's going to get added to their bottom line. And so what we are doing is we are trying to stay abreast of everything that's going on because we know that all of these factors are going to impact the future costs for employers, and we need to be in a position to include all the appropriate factors for clients and prospects so that we can give them an accurate projection in terms of what's coming down the pike. And so with the second wave, we will have gathered additional information and have a much better assessment as to what those costs are going to be so that we can take that into account.
It's really interesting. It's a lot to account for. You know, and I've just never been more proud of you know, my teammates. Frankly, you guys have put a ton of energy into what we're doing for our clients over the last couple weeks. Yourself, Stan, Sarah, our registered nurse. What I appreciate so much about what we're doing on the financial impact study that we have brought to the market for our clients is really, you know, bucketed in three different tranches. You know, what's already occurred, what's coming, you know, what's down the road, and then helping our clients understand what actions need to be taken. And we have of course a slightly different reporting package that we're providing to non-Apex clients. But we've opened this up to any employer that really would like the insight. So, you know, guys, thanks so much for carving some time out to join us, you know, join me on the podcast and you know, share so much with our listeners. So really appreciate it.
Sure thing, Scott.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.